We are live.
Hey.
Okay.
Oh, so you gotta mess with it now.
Well,
we just started. It's all perfect.
I feel like we're a little far back.
No, we're great. I'm comfortable. Otherwise, it's a strain. All right. So welcome everybody.
Hey, Kimberly Wujek. How you doing?
Wujek.
She's coming in hopefully tomorrow. Don't stand me up.
Don't stand me up.
What?
Has that happened before?
No, I mean, but it was like a tentative schedule.
Kim Wujek, thanks for all your support.
Mm-hmm.
I appreciate it. We appreciate it. We need to do another one of those. What was it called? Where we did it's all talk, no video.
Clubhouse.
Clubhouse, yeah. We did that, and I know, right? Never stood you up. So, Mrs. Mac, hi.
Hi, Ms. Mac 2018, and we got Palmer.
Yeah, so we did the Clubhouse, which, that was the only time we did it. It was great. I loved it.
We did Clubhouse once, yeah.
But we haven't been back on it.
But, today we thought we'd do something a little bit different and just keep ourselves available for anybody that has any question for the two of us. We're here to answer any questions.
That's so like when hey. So when the questions come up, I can read it I can read it, but now I can really read it. Yeah, we need more Clubhouse, right? Is it still a thing, right? It hasn't gone away.
It's still a thing, there's a lot of things.
There's so much going on, right? It's hard to keep up with all this stuff, and we spend most of our time taking care of patients, and then doing the social media.
I spend most of my time taking care of you. You know how it is for all those married girls out there. You know exactly what I'm talking about.
Hey, listen, yeah. So Sarah does help take care of things. I admit that, and if it wasn't for this girl right here, we wouldn't be where we're at today.
So we're getting a question on what is Clubhouse. So Clubhouse is like a live. What do you call those things where people talk?
It's like a live podcast.
Right? It's a live podcast.
So there's no video. It's all audio, and people can participate in the conversation, and you can kind of let people in, and you can ask questions. It actually works really well.
It's kind of like a forum. It's kind of like this, where a lot of people, you can hear a lot of voices, and it's a live podcast that many people can join, and talk about any topic. So a lot of times there's tech people on there. Yeah. There's
whatever topics. I popped it on and I listened to Tony Hawk the other day. Well, not the other day. It's been some weeks, but I like skateboarding stuff. So he was chatting it up. But it's like a talk show. It's like a radio show, But people can, instead of calling in like the old school, you just hit the little button that says, "Hey, someone's got a question," and you let them in and you chat it up. Invite-only platform.
We have Teresa.
So it seems so. Clubhouse is an invite-only platform, but more and more people are on it. So it doesn't mean that you can't get on. You just gotta get interested, and then you'll find somebody who's on it, and then get the invite and go from there.
Right.
So maybe we'll do that. That's I liked it.
Clubhouse. Yes. So we thought that we would keep ourselves available for anybody that had a question. Oh, Kimberly Wujek is saying there are people on Clubhouse that would never be doing anything like this if it wasn't for COVID-19. It's a platform that opened up communication like a stage of 7,000 people would. That is very true, Kimberly. And, there's some groups that have thousands and thousands of people listening, depending on what the subject is. So it's great. It's great for that. We wanted to.
Man, I need some Botox. Look, you're neglecting me.
You do need Botox. So
my brows are getting heavy. As I get older, my brows are coming down. So I need a little elevation, right? So we do a little.
Do you guys think he needs Botox? I think men look distinguished with some wrinkles across the forehead.
Well, yeah, I'm not talking about my forehead.
What are you talking about?
I'm talking about here.
That's your forehead. I mean, kinda. It's like the glove.
Wait a second.
It's kinda.
You're fired.
It's kinda.
Forehead, right? But this is the frown lines, right? So this pulls down, and I, get a little Botox in there and elevate it a little bit, and around the eyes would be nice. I'm not talking about freezing my face.
Around the eyes and between your eyes, and What do you mean? I'm talking about freezing your face. You're talking about freezing your face.
I'm not talking about freezing my face. I'm gonna freeze your
What
face.
do you guys think?
I'm gonna freeze your face.
I'm gonna freeze your tongue. My dad can be your dad.
Hey, don't talk about my guy. It's so cool. God. So
Anyway. So tomorrow is Earth Day, for those of you that don't know.
Isn't every day Earth Day?
Well, I guess.
You know, God,
whatever. It's going to be an Earth Day.
Yeah.
What does that even mean?
That means that we're
celebrate the earth,
honoring the ground below us, and
by creating
all the things
creating
it
more
provides.
garbage and stuff.
No, by creating less garbage, by recognizing, listen, she's one to not make extra garbage. When I get a paper plate, she's like, "What are you doing? You're polluting the earth," and I'm like, "Well."
Yeah, he lives with paper plates, foam, all this stuff, and I'm like, "What are you doing? We've got plates and stuff that."
Listen, I personally don't mind a paper plate because he doesn't
want to clean it.
I don't have to wash the dishes, and I'm always washing the dishes. So,
sometimes for dinner he'll get me a real plate and he'll put his dinner on a paper plate, and I'm like, what are you doing?
You know why I do that? Because
he does that.
She doesn't like the paper plates. She's all bougie and stuff and likes the real plate.
Well, I don't think you should be wasting paper for something like that when you can be cleaning it.
You like the nice solid plate and how that looks.
You're making garbage for no reason.
That's the number one reason.
Making
garbage. And you use the garbage excuse to make it legit.
I'm telling you.
I think that's garbage.
Whatever you say to make yourself feel better for creating trash.
Well, listen, I one wheel back and forth to work, so I'm using electric. So my carbon footprint's less in that regards, and I use the car, so making up for it like that.
Okay.
I'm gonna one wheel with a paper plate.
Oh, God.
As a mask.
Why don't you just walk to work? So as you're saying, Earth Day, Earth Day. Gotta love it.
Okay, yeah. So what do you want to say about Earth Day that you don't know anything about?
Well, I was going to say, we do protect the environment with our skincare products.
Oh, yeah.
I'm going to tie it all
and we're creatures of the earth, so.
And we're tying...
Unless you watch Ancient Aliens, and then you might be...
Okay.
Yeah, so.
What's in your coffee?
We know a thing or two because we've seen a thing or two.
Please, someone ask him a lipo question so we can get him talking about something serious. But what I was saying about our products, they are all natural products. They are not tested on animals, and they are free of parabens, sulfates, and formaldehyde. And parabens do leach into, and sulfates into the ocean when you go swimming, and can kill coral and things like that. We have our first question.
Oh, Mrs. Mike, watch out, don't knock over the skincare.
When would you opt for a full-blown tummy tuck? I've had multiple abdominal lipo, and I tend to scar. What do you mean tend to scar with abdominal lipo? Can you get rid of scar tissue with a tummy tuck above the navel? I mean.
So, right, I know you, right? So I know what you're talking about. So what I believe she's referring to is after you've had multiple rounds of lipo, right? And if lipo resulted in some irregularities with the first go around, meaning, and a lot of people then chalk it up to it's scar tissue, which it is. Everybody heals by forming a scar, inside, outside. And when you have some irregularities from the lipo, say, not being so smooth initially, it's kind of hard to get away from that no matter how much more lipo you have. So you can't remove scar tissue from the inside, really, because it's all part of the tissue itself. So it's more of a redraping, right? So I always think of like a sheet. Like a sheet is kind of bunched up on the bed, and if you want to make it look smooth, you pull it nice and tight, right?
Well, let's talk about where tummy tuck is.
I knew you were going to jump in there, right? So you will... so the whole idea is to take out the excess skin that's below the belly button and then elevate that skin that's above the belly button and bring it down like a sheet nice and tight. So that helps even out some irregularities because it pulls it nice and tight and gets rid of all the kind of bunched up skin or skin redundancy. Now there still can be some irregularities in that what we call flap, in that sheet, if the sheet is not super even, but it becomes a lot smoother when you pull it tight. So you can't just go in and cut out scar tissue from the inside from previous lipo because it's all mixed in with the tissue, and you wind up just devitalizing that tissue that the scar tissue is underneath.
So if somebody has stretch marks all over their stomach, when you do a tummy tuck, you're cutting from where to where and cutting out what tissue?
So, the full-blown tummy tuck, I like
Yes.
that.
What is a full-blown...
Sorry.
Oh, here we go.
Sorry,
Here we
moving
go.
around.
What is a full-blown tummy tuck, and where are you cutting? What tissue are you cutting out when you do a tummy tuck?
So the incision is as low as it can go. And so what that means is I typically, that lower transverse incision, like where the C-section scar is, but an extension of that, it's placed very low. I typically measure from the clitoris area or the base of the penis, right? I mean, that's just the landmark. And it's typically about 6 centimeters above that. So if you ever have a ruler and you want to measure something else, so that's kind of the low point of the incision. And then it curves up, heading up towards kind of the hip bones. But we like to keep it nice and low. And so the length of that incision is typically kind of hip to hip. It can be shorter. It depends on the anatomy and how much skin redundancy. Now that's the lower part of the ellipse. The upper part of the ellipse is all the way up to the belly button.
Under the belly button or over the belly button?
So it's really right at the belly button. It's at the upper edge of the belly button ideally, okay? And so you take all that skin out. So it's essentially from the belly button down to the pubic area and from hip to hip in an elliptical type fashion, that all that skin comes out.
It's kind of like the shape of an eye.
Right?
Like that.
And so that's all the skin and soft tissue that comes out. Skin and underlying fatty tissue and connective tissue. And what you see, if you've seen any videos, the underlying exposure is the muscles of the abdomen, right? The fascia and the muscles. Then we take all that skin that's above that remains intact and it gets elevated, still stays attached to your upper abdomen, and then it's pulled down like a sheet to then cover all of the lower part that's been removed.
And then you make a new hole for a new belly button.
Yes. So the belly button, people are like, oh, so what do you do with my belly button, right? Do you take it off and put it back on? No. So the belly button, you think it was like, it has a stalk, it's attached to the deeper part of you. You make an incision around the belly button, you isolate that, you can let it stay attached to the deeper you, and then the skin's brought over the top of it, and then an incision is made that mimics the anatomy of the belly button, and the belly button's brought up through the skin and stitched in place.
So in order to have that tissue from above the belly button stretch all the way down to the pubic area, they had to have had a big stretch of that skin. Like, what if that skin doesn't reach all the way down when you pull it tight? What do you do then?
Then we quit. No. So that's really determined in the consultation. I determine how much kind of laxity there is, if there is enough room to kind of bring everything down, and there usually is, right? But in the case that there is not enough skin, then sometimes we have to not come up as high as the belly button, and we're taking out less skin, so we still have a longer piece of sheet, so to speak, to make it all the way down. And that's rare, but that is occasionally the case, and in that case, sometimes you have a little vertical component of that lower horizontal incision. Sorry, we're seeing questions down there, so it's a little distracting.
I love how I anticipate the next question.
I noticed that Mrs. Mack said bummer to my response. I wouldn't look at it like that, okay? Because it's not about, like, we can't take out the scar tissue. That's not the move. The move is to pull everything tight. And when you pull everything tight, the areas of irregularity of where scar tissues smooth out. Now, they may not be perfectly smooth, but a lot of times they are.
But we can also do treatments like microneedling or radiofrequency or laser to help mute out any kind of, say if it was stretch marks and things like that.
Yes, but she's not talking about that.
I'm talking about
the deeper tissue, the deeper tissue where the scar is in underneath the skin.
Right, the irregularity from previous lipo.
Right.
I know. I'm just talking about the overlying skin. A lot of people have stretch marks all the way up there. So you said you go cut down all the way to the base of the penis. So that means you do tummy tucks in men?
Yes.
Okay.
You said penis. Right, yes. I got to say it. So yeah, we do tummy tucks in men. We have somebody that we did that is a lovely patient, but we haven't been able to show his before and after photos. And it looks so awesome, and I was just like, oh, I wish I could show you. But maybe one day, maybe he'll feel comfortable with it. But yeah, we do it in men. A lot of times.
So it's massive weight loss patient? What kind of patient are we?
It's getting there.
Mm-hmm,
yeah.
I'm anticipating.
So a lot of times it's patients that have lost a ton of weight, right? They got themselves in shape. they have shrunk down to their ideal body weight, and their skin hasn't followed suit, and it has a lot of laxity. And there's nothing you can do about that unless you do a tummy tuck.
But you also do, are you doing a tummy tuck where you're repositioning their belly button? Or are you doing more of a paniculectomy, which is just cutting the lower skin out, or doing a mini, what's the tiny,
Mini tuck.
Mini tuck.
What's that?
What's that? What exactly is a mini tuck? And when do you offer a mini tuck? And how is that done?
So there's a lot of terminology: the mini tuck, the tummy tuck, the paniculectomy.
What's the difference?
Right? So it refers to how much skin is removed.
Hi, Mama
right?
T.
So everybody knows pretty much like full tummy tuck. We just talked about that, or full blown tummy tuck. I like that. That's removal of the most amount of skin, right, from the belly button down to the pubic area and kind of hip to hip. It's a large amount of skin removed. And then the next kind of tier down is paniculectomy, and that is referring to that pannus, right? So somebody comes in and they've got a lot of overhanging skin and tissue below the belly button, and they don't want to do a full tummy tuck.
It's almost like a big pancake that hangs down,
like a fanny pack.
Yeah, like a fanny pack.
And so they have that hanging there, and they want that gone. They don't want to do a full tummy tuck, or they're just too big really to do a full tummy tuck, and they're like really overweight, and they just have this overhanging pannus. So it's just removal of that over
skin only.
Yeah, skin and soft tissue. I mean, it's
but
removal of all of it. Yes.
But no muscle plication.
No muscle tightening, right? So then there's mini tuck, which is essentially like your C-section scar, but a little longer, and it's removal of tissue in elliptical fashion right around the C-section scar, and it allows us to get some tightening below the belly button. It doesn't give any tightening above the belly button, but some patients,
no movement of the belly
patients
button.
come in with there's no touching of the belly button. Essentially, we typically do a lot of liposculpting all in the front, so we thin things out and remove that excess tissue just at the lower part here in a short scar formation. So it helps give some tightening below the belly button.
Yeah, a lot of women complain of like a little pooch after a C-section, where they have a little bit of like, a little pooch there. And this is like a revision. It could be a revision of that scar. Could just be a revision in somebody that, or just cutting out the tissue. And you do that. You couple that sometimes. Which ones have to be done asleep? Which ones can be done awake? Can you do all of it awake? Can you not? Which ones? Clarify.
Yeah, please clarify. Full tummy tucks, general anesthesia. You got to be asleep for that. I haven't figured out how to do that in the awake setting yet. Because there is a large amount. It's not necessarily the skin removal that is the limitation. It's really the elevation of the flap. So all the skin that gets elevated up high up into the upper abdomen. That is a little challenging to numb completely, to get it really elevated. And then you got to pull things tight, so pulling it down, there can be some discomfort with that. And then mostly it's the muscle tightening. So the stitching of the muscle, that internal corset, when we're grabbing a hold of that fascia, bringing it together, if you've ever seen any videos of that, that's uncomfortable in the awake setting. Sorry, I keep hitting that. That's uncomfortable and not tolerable in the awake setting. So, with really, it's possible with specialized numbing, but it's just one of those things that we haven't done as of this time. Now, I was thinking about it the other day, because could we do a tummy tuck without the muscle tightening in the awake setting? And the answer is likely so, and in special selected patients who have a lot of laxity.
Who don't need the muscle tightening.
Yeah, who don't need the muscle tightening. But the problem is that pretty much everybody needs a muscle tightening. And if you're there and it's exposed,
you might as well get it.
You might as well get it tightened. Because I have some patients come in and say, you know what, I don't really want the muscle tightening. I don't want the recovery that goes with it. And I'm like, listen,
it all sucks.
You're going to regret it. Because if I'm in there and everything's exposed, you want to maximize all that circumferential shrinkage. And you want that corset, that tightening is going to get you flatter. It's going to get you that long-term result. And going back and doing it again, if you do it without the muscle tightening, and you're like, oh gosh, I wish I'd done the muscle tightening. I mean, there's really not you can go back in, but nobody's doing that. So,
Now no one's going back in just to do the muscle tightening.
Yeah, I mean, because then you got to go through everything all over again. So, all the other procedures, like the mini tuck and the paniculectomy, all done awake but relaxed in the office because that tissue can be numbed very thoroughly, and it's very tolerable in the awake setting. In fact, I don't even offer it under general anesthesia, just not needed. Great moderator.
Praise again.
So, when someone says grill him, Zach is there.
Okay, so let's talk about some of the signature procedures that we do in the office.
Definitely Precision Sculpt, which is our awake liposculpting procedure.
I was going to start with ladies first. Excuse me. I was going to start with the painless lip aug.
Oh, my bad.
Yeah,
Okay.
It's always about him. Let me squeeze him out of this. We do this thing called the painless lip aug where...
this thing. This little thing.
Where, you get dental blocks before, and so the lips become very numb and can be strategically filled in such a way that gives a nice, fill natural. You know what? You can do a lip aug. Shall you do a lip aug in him? And then...
Can I get some Botox first?
Right. And then, so that's one. We do our new fill and flip, which is lip aug with a lip flip.
Fill and flip. Oh,
Fill and flip.
Wow.
Ashley came up with that. I really
You
like
know,
that. I have to give her props for that. That's Ashley.
That's Phil and Rowena, right? Yeah, Fill and flip.
That's right. And we have Miss Jasmine, our front...
Jazzo.
Miss Jazzo, who is running the front of our office, and she says, didn't feel a thing when you did mine. Love my lips. So if you guys watched the live last week, I did her lips for her wedding that's coming up. Let's see what else.
All right, so she says, she's saying she didn't feel a thing. Now, with that, it's not that you don't feel anything, right? You're going to feel the numbing of it, but it's really tolerable. A special technique using the vibrating device. What do you guys call it? I want to say vibrator, but
it's a facial massager.
Facial massager. And
it's a mental distractor.
That's what I say. I started saying that at night. So the facial massager, and then shaking of the tissue when we're injecting and putting it in special spots at first makes it really tolerable. And then once it's in, then everything's nice and blocked.
Yeah, and then you don't feel anything. So it says, can you show us what the dental block looks like? I don't have a syringe, but say this was my needle. I would just, of course, be gloved up. And I would just lift up here and then go through here so that it would be in the inside, right where your mucosa and the lip meet, right in the corner. It would just inject, just like a dentist would do. When you go to the dentist and they give you a block in your mouth to numb your lips and mouth, there's 4 nerves that exit out. The nerve right here exits out and innervates the whole lower lip area. And then you have your infraorbital foramen here where the nerve comes out and innervates the top of the lip. So I'm aiming for these 4 foramen, the mental foramens and the 2 infraorbital foramen, and I'm going inside and aiming for those. So basically it's like typically 4 injections, 4 to 8 injections. Sometimes this one you need just like an extra 2 down here. And it's just inside, we wait, we let it all numb up. And then, the lip can be strategically injected with no pain. If you guys have ever had any kind of blemish right along the lip line, it's incredibly painful. It's kind of like that when the needle goes through. So the block really, really makes a huge difference. It lasts about an hour and wears off. The stuff that I'm injecting contains numbing medicine as well, so...
the filler that she's injecting is mixed with a little numbing medication.
That's what I meant. So it will remain, your lips will remain a little bit numb beyond the dental block. The stuff. How many days does it take to recover from a lip aug? So Miss Mack wants to know how many days does it take to recover from a lip aug. That all depends on what you were doing before you got the lip aug. If you were doing a lot of boozing and took a lot of aspirin and Motrin and all this other stuff before you came on, you're going to expect to get a little bruising around the lips.
Not with you.
Well, it's still like, minimal
understand,
bruising, like where the injections were. You might get a little teeny tiny bruises. It won't be this huge thing, but so that could take a little bit to go away, maybe a week. Depending on the filler used, some fillers swell more than others, but you should expect about a week.
So, but I always
to 2
say,
weeks.
what is it, what do you mean by how long does it take to recover? So, do you mean like at what point are you presentable where you don't have to be worrying about just having the stigmata of having your lips done? It may take a week. It may take a couple days. It depends on how much filler you received. Depends on where your lips started, right?
It depends on how leaky your blood is.
You might be liking it right. You're gonna be liking it the day of, but it may take you a couple of days to get to a point where you're just like, you're not even worried about somebody looking at you going, oh, you just had your lips done, right? It might be at 24 hours. It could be 3 days. Some patients even at like you said, a week might have a little spotty bruise, but you can put lipstick and you can put cover up and manage it.
If you're somebody that works full time and you're worried about what it's going to look like when you're at work and you want to be presentable for that, the best is to get your lips done on a Friday and let the majority of the swelling kind of dissipate over the weekend. That's kind of the best. But if you have a big event, any large event, I would say make sure you come about 3 weeks before that big event, 2 to 3 weeks before the big event, because in the off chance that you do have some bruising, it will be cleared up by then. You don't want to I have a big event this weekend. Can you do my lips? Well, no, it's Wednesday. Like you might be bruised.
You can, but you just have to know what you're getting into, right?
I just tell everybody there's a chance, and nobody really wants to go through that chance. Most people say, okay, well, I'll just come back Monday, or I'll do it after the weekend.
Right. We just had a patient come in yesterday, consultation. And she's a great candidate for facial fat transfer. She's had facelift in the past, and she needs volume, right? And she needs pan facial. So what I mean is kind of all over. But she also has some very fine lines here, and that's still a great area for the hyaluronic acids, the HAs, the Restylane, things like that, to place, or the RHAs, right in the skin itself. And those work great, but they can
But she had an event today.
But they can have some bruising in that line.
So we talked her out of it, and she's coming tomorrow to be injected.
Oh, awesome.
Yeah, she's my first patient tomorrow.
All right, great.
So, little things like that. Like if you're like, I've got this big event, you just want to wait till after your event to get any filler.
I feel like now we're going to start hearing that more often. Big events. I got this event, right? Because everything's opening back up.
Yeah.
So
and we have the award shows, and we have everything coming, all the Grammys and the Oscars and all this.
Mm-hmm.
So
the main event.
I'm telling you, don't come at the last minute. I'm going to tell you no. So if you want your lips to look good on that red carpet, you better come in advance, and you guys know who you are. So we do have actually a new skin regimen called the Main Event. And it is now live online, and that contains our 3 main products that make your skin glow and look amazing. And that is our Wrinkle Erase Serum, which is this, our Filler in a Bottle, which is this, and our Premium Growth Factor. So these are the 3 things that we recommend for all the brides out there, for all the red carpet ready people. These are the 3 products that you want to make your skin glow and look amazing. I mean, look at my skin. It looks amazing. Looks
I put it on every morning.
So that is available online. What else? So the hyaluronic acid filler, what else do we have going on? We have the lip and fill and flip with the lips.
I like that. That's fun.
And for anybody that wants to show more of their pink, that maybe has a little bit of show of their gums, we can do a strategic blocks to lower the lip and also flip the lip a little bit and show a little bit more of the pink. So that can just be a pure lip flip, and that works great in people that still have a good volume of the pink, but want more show of it.
I wish we could have some lips flipping. I don't know what we're talking
about. We should have the next time. We should do it with the TV in the back with all the before and afters running. Okay, that might be a good idea.
Hey, good. Wow.
So we also have the Radiant Facial, which is a combination of microneedling and radio frequency to help tighten, microneedling, and PRP that can really transform people. For anybody that has like acne scars or irregularity to the skin, you want to consider doing a resurfacing procedure to smooth the skin out, and then you supplement it with products afterwards.
It's time for that as well. Huh?
Yeah. So patients will come to me and they'll say, "What do you think? What do you think I need?" And so you want to get a little closer. So I don't know if you guys can make it out. Probably not with Dr. Justin, but
Well, it's
well,
whiting out.
Yeah. So as we age, the skin texture gets a little rougher, and in his case, you can kind of see it. You can see his. I don't know. Let me turn this down a little bit. Maybe you can see it a little bit better. So you can see he's got a little bit of rough skin here, and it's, deeper lines. And then, there's usually some roughness to the skin in this area and on the nose. So any procedure like microneedling or skin resurfacing or something like that would start to smooth out the skin, and then you want to feed the skin with products like growth factors and
we have growth factor here too, right?
Yeah, right.
Yeah, the premium growth factor.
Right.
Uh-huh.
So it's done. You use that twice a day. It's a cream. It really will transform your skin. It protects your skin against a lot of the harmful UVA and UVB rays and
the damage, right?
And the damage and all the environmental damage and
repairs.
pollution. It repairs your DNA and it builds your collagen and elastin. So it's something that you want to consider over the age of 30. To kind of supplement your skincare. Definitely over the age of 40, you want to start using it, which is...
Speaking of that, so Mrs. Mack, I just thought about something. The irregularities, the scar tissue that's associated with previous lipo, if you don't want to jump into a tummy tuck, there is an alternative where we inject Sculptra into those areas, and it causes your body to build collagen, and it can help fill in areas that are irregular. Now, it's a project, right? It takes time and it takes multiple treatments. It's easy in the sense that you come in, it's an easy injectable into the skin, boom, you're in and out. You come back after about 4 to 8 weeks max, you get another round, and then we start evaluating. Usually after that second injection, you come back around the 4 to 6 week mark. We take a look, take pictures, start deciding on, hey, did he reach a happy place? Do we want to do more? Which is likely the case. You kind of be like, I like it, and yes, I want to do another round, and we start planning for that. And so that's Sculptra, and it's a really nice, it's not a filler, it's a bioactivating agent, but that results in filling, but it's filling with your own collagen. And we use it in all areas. Face, we use it in buttock and hip dip areas, and we use it in irregularities. And so that could be an option for you or anybody that has post liposuction irregularities to give it some more volume in that zone that's a little depressed compared to something adjacent.
So we'll touch on that in 1 second, but we have a question. Could Botox and chemical peels be done in the same appointment? Yes, and we often do that. Botox can be coupled with many things in the same appointment. It's just done after we're completely done with whatever it is. So we'll do the chemical peel first, and then I'll Botox over the chemical peel, But so we have chemical peels, we have medical grade chemical peels at all different strengths. We basically have 6 different strengths, from what we say is like a Hollywood Glow, which is just like a strong salicylic acid, all the way to, like, if you can picture like a snake shedding their skin, like thick layer coming off. So we have all different grades. So no matter what your Fitzpatrick scale is, if you're whether you're like an albino or white or redhead with blue eyes, which you're a 1, or you're very dark skinned and you're a 6, anywhere in between, we have a chemical peel that can match whatever your skin tone is and whatever your ailment might be, whether it is just some irregularity, dark spots, sunspots, or acne. We have a peel for some. And then we can just Botox right after that is done. We put the Botox in, and then you walk out We also couple Botox with other procedures, other resurfacing procedures, such as lasers or IPL. We can do that as well in the same day. I just would do it after you're done with that procedure. Right?
Boom.
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 So
the answer is yes, you can do chemical peels and Botox the same day.
So Miss Matt saying she's going to be back in LA soon. We can't wait to see you.
Awesome. Where are you in Italy?
Right. So Sculptra, like he was saying, he uses it a lot for people that come in. He sees a lot of patients for a revision lipo who are done by other places and need and want some corrective work. And so it's not only a second round of liposuction, but sometimes people are lipo too far, into an extreme. So you have to kind of work with that and figure out, well, okay, when you've got these big irregularities, how are you going to fix some of those? And we've noticed that Sculptra is a great option for that. Sculptra is also used in the face. We've used it off-label in other areas of the body, such as the breasts, the butt.
This is going to be a good one. We got something special to show you later. Well, Netflix will show you.
So we have a patient that came in a couple months ago for my first peel. Let us know what you think about the peel and how your results were. We'd love for the audience to hear about it. Oh, Miss Mac's in Florida.
Florida.
We used to live in Florida. We used to live in South Beach. It was great. All of our training was in Florida, in Jackson Memorial Hospital.
Right.
Yeah. Right.
Sarah and I were in residency together. A lot of people ask, like, where did you meet? Well, we met in medical school. We trained in residency together, so we are both our first year of residency, so that is the first thing you do outside of medical school. We both did surgery internship.
General surgery internship.
So we were running around taking care of surgical patients together. Not together, but on different services, but in the same hospital. So we've been kind of tag teaming it. Mm-hmm. For a long time, and then and then we still stayed.
We were never on the same team, though. No. Yeah, no.
They knew better.
Yeah, we were never on the same team, but we did.
Telling me what to do. God.
But
you're like chief resident.
I gave you 1 year off where I didn't have to tell you what to do. But yeah, we were both did surgery our first year together. You were a categorical resident, so he was like supposed to continue with surgery, and I was going to continue with anesthesia, and so. And then, we did that together, even in the OR.
All right, so there's only, believe it or not, for the 5 years of my general surgery, so it's 4 years, 3 years that you were essentially in the rooms. So I think you were only in my room twice for the 3 years, where she was the anesthesia provider and I was the surgeon.
And I said, do not ever put me in his room again.
And those general surgeons, it's just an excuse to abuse the residents. So I was getting abused.
I'm the only one that can abuse you. Nobody else can.
Oh, that's BS.
He knows I love him. June will be how many years together? 19 years married. 19 years married.
All right, so would Dr. Sarah be the anesthesiologist if you do my tummy tuck?
I'm quitting anesthesia. I'm not doing it anymore. But yeah, I mean, I have provided anesthesia for
You have to lobby cases. For that. She's getting very picky because she's got a very busy injectable side, and so...
I've been doing it less and less and less.
Yeah, so she's a little picky on that, but that doesn't mean it's a no. Just, you have to sweet talk her.
Mm-hmm. Yeah, so any other questions?
I love it when she's my anesthesiologist. She's on top of it, man. She's like really, really good. Not because she's my wife, but because she's super sharp and she's like wants to be the best and really provides and really like a superb care, and she's super knowledgeable about like the meds and what to give and when to get it and what's going on, and she also knows the surgical side of it.
You'd hope so. I mean, I wouldn't want to,
No, but you're
you wouldn't
very
want an
involved.
anesthesiologist that's like, what's propofol? Like, whoops. I know she likes peonies. I do like peonies. That was my bouquet for our wedding, was peonies.
How do you know she likes peonies?
I probably talked about it.
Okay.
How do I get rid of stomach rolls? Well, that's a loaded question. Oh, we got Victoria Rose from
nice.
Victoria Rose, Beverly Hills. If anybody wants an amazing shop to shop at on Bedford in Beverly Hills, it's Victoria Rose. I get all my pants from there.
And I love them.
Yeah, I need to go back. And I almost stopped them today, I have to admit. But then I had my I just came from the dentist, and I was like, I don't know if I can deal with shopping right now.
Oh, yeah, so Dr. Danny, right? We're going to have him on as a guest, right?
Yeah, he's talking about cosmetic dentistry. We're going to see Dr. Justin get cosmetic dentistry live. So we are going to plan for that for all of you guys. I've been trying to get
in my mouth for years.
We got Gina Bax joining us. Hello, Gina.
So stomach rolls, right? I mean, stomach rolls is the biggest approach, most common approach is Precision Sculpt, where we're doing an advanced awake liposculpting to shrink down and thin out that layer, so that way the fullness is less and we get things to move in and we get you nice and sculpted. But if you're talking about like excess skin and kind of hanging skin, then we start entertaining skin removal like mini tuck or a tummy tuck. But it all depends on what you're presenting with. But the most common approach is to sculpt the fat out.
Yeah, someone's asking at Wake Dentistry. Yes, I want him to see Dr. Danny, but Dr. Danny said maybe you'd come in for a cleaning. I think he's starting low.
Clean up.
He was saying he'd come up with a little cleaning, and then maybe you guys can talk about...
Are you talking shit about my mouth?
Well, I asked Dr. Danny to be a guest, and he said yes. And so Dr. Danny does cosmetic dentistry. He's at Bedford. His company's Bedford Dental Group, and if you go on his Instagram, you'll see that he does all the celebrities. And we're going to talk about cosmetic
right?
dentistry.
They'll always pose with the dentist, but they don't pose with the plastic surgeon, man.
Yeah. But they'll admit that their whole face is redone, like their whole mouth is redone, and it's all cosmetic dentistry. But they won't admit that their whole face is redone or their body's redone. They won't admit to that. But
that's all right.
Slowly they'll admit. Slowly they're admitting.
I see Gina's out of her products, and she's getting depressed because of that. So
Gina, we got them all here for you. Running out of my face products.
Gina, we got to plan a golf outing where your husband and I get to play golf and the ladies get to enjoy their spa and resort. So we got to plan that soon. But I know you're going to be out, right? You're going to be like off to Colombia.
Gina's going to Colombia. So we have a patient that says she's gathering her pictures. She loves it. She's recovering from her cystic acne, and her skin's cleared up great and is still in the process. So she had a skin peel, and she's in the process of it clearing up. And
did you get some products? You said you recommended some products.
I recommended some products, probably the retinol, and retinol's great because it increases your cell turnover. So long after the peel's done, it's going to increase your cell turnover and stimulate collagen and elastin. So retinol is one of those products that is you have to use it consistently, and depending on how old you are, how many decades of life you're in. So if you're in your 40s, if you're in your 40s, you want to get yourself to use it 4 nights a week. If you're in your 30s, 3 nights a week. If you're in your 20s, 2 nights a week.
Oh, that's convenient.
Yep.
Yeah.
I saw that on YouTube. No, but yeah. So you want to start doing that and get yourself to use retinol on a regular basis. I'm using it almost every day. Every night
you're on for 5 days a week?
Oh, Jesus. But, listen, to make your skin look amazing. I had 2 cups
of coffee, if you can't tell. So I'm just going to step away for a minute.
Because it's got a bladder this big.
Yeah, it was like a golf ball.
So
why don't you talk about the wedding stuff? There's some wedding packets and things like that.
So for people that have been watching, I did have Brooke Heflin on from her Instagram is something in Bordeaux. Oh God, I'm terrible. Anyway, you can watch one of the previous lives that we've had, and she talked. I mean, if you guys haven't seen that live, definitely go into my Instagram and watch it. She has so many pearls on what you could do for your wedding, everything that a planner does from you from start to finish of the event. She does even beyond weddings. She does big events, red carpet events, new product launches, new office openings, anything that you could possibly want. But specifically for weddings, she gives a lot of pearls on what you want to do as far as when you want to take your pictures. Do you want to take it before the ceremony, after the actual ceremony? When do you want to see your groom, before or after? She talks about the dress and your fittings and your refittings. She talks about what else did she talk about? Like
we're talking about the Brooke?
Brooke, yeah. She talked about everything, so many pearls when it came to weddings. It was amazing. We're talking about getting married again, you know. I think I just want a new ring.
God, never change.
You know. And we have Gina Bax on there. She says, Gina Bax says, we got some more comments. Hold on. So she says she loves the sunblock. It works perfect for her skin tone, and she doesn't need any extra foundation. So we have 2 sunblocks. We're thinking about adding a third. Our 2 sunblocks, and for those of you that don't know the differences in sunblock, there are physical blockers and chemical blockers. So physical blockers just block the sun's rays from even being absorbed in. It's kind of like a mask. Ours happens to be tinted and mixed with hyaluronic acid. So it hydrates you at the same time that it blocks the sun's rays from hitting you. So it's the best of both worlds. But ours is tinted, which is what Gina uses, which is great because it can be used on all skin tones.
Gina, get your daughter to TikTok that stuff, right? I know she's on that TikTok.
That's right.
So you got to get her to put that YovinoMD skincare on there.
Gina's got 5 daughters, so you got all the 5 posting it on their TikToks, Gina. And then we have a chemical blocker. A chemical blocker works a little bit differently. It's great for sports. He loves it. We have our sports defense, and it absorbs into the skin, and then it allows the rays to absorb in, and then it converts the rays to heat, and then you sweat off the heat.
What I really like is that it doesn't burn my eyes, because in the past, before we got our products, I would use spray on stuff, and then I get over the putt, or whatever, and it's like I'm sweating a little bit, and then all of a sudden it's burning in my eyes, and you can't see anything. So now it doesn't burn at all, which is great.
And for me, a lot of sunblocks that I used would make me break out. Like I would get big pimples, and I don't get pimples. And so this doesn't do that. So Gina's daughter's using the sunblock too. Gina's got a redheaded daughter, and I bet that's who she's talking about. Gabriella, we love her. And then Mrs. Mack says ditto on the sunblock. She loves it. And then let's see. Bring the cute bags. We will. Yeah. We've got Christian with M Sculpt joining. I wish you guys.
I have 5 weddings.
Wedding. Yep.
Yeah. Near future.
Gina's got 5 weddings. She's got a Columbia husband too. She doesn't want anybody knowing about it. No, I'm kidding. He believed me for a second, Gina. Did you see that? She goes to Columbia every year for about 2 months in the summer, and she's got her side guys on the Victoria Rose says she needs her sunblock. She's going to Israel on Monday. You do need it, so come in. Whoops. I have a couple of acne defense, but I would love to invest in more for sure. I'm enjoying the products. Appreciate you, Dr. Sarah. Oh, thank you. Yeah, the acne defense is amazing. It's spot treat, and it comes in a little pump, and it is a serum, and you place it right on your acne, and it dries it up pretty quickly. If you can avoid picking, which I sometimes have a problem with. Let's see who else. We got Rose. I'm trying to answer all our comments. Don't worry, we won't tell your husband Stacy.
Right now.
I know.
It's okay. We always talk about golf anyway. And biking.
I heard all the messages of Stacy calling, talking about his golf swing.
I'm worried he's going to beat me soon.
He will. Her husband's very athletic. Gina Bax's husband. Yeah. He's an anesthesiologist too. Nope. And he has, he's good. He's good at sports. He's very athletic.
Yeah. All right. So should we wrap it up? We're kind of.
Where are we? Yeah. We're getting close. There are some specials for people that have been listening to the whole Precision Sculpt thing and stuff like that. We have arms, special for arms with our. With Dr. Hakimi, who's also in our practice, and arms are $4,995. Chin and neck is $3,995, and Abdominal 360 is $7,995 with Dr. Hakimi. So those are very affordable prices for some people. And then let's see, and if you come in and you get like the painless lip aug or you get whatever non-surgical services with me, our skincare is always 15% off the day that you have your procedure. And we have a fan of Dr. Hakimi's, Lil Miss Lids. She thinks Dr. Hakimi is amazing. He is. We love Gina too. Bye, Gina. We have Nicole Isaac on. Hello, welcome. So we were here to answer any question. Oh, and also another thing is that if you get a surgical service, then you will get a 20% off all our non-surgical services for 1 year following that procedure. So we have that available for our surgical patients.
Yeah, it's just, I was the inhaler girl.
Oh, yeah, I remember you, girl. I had to break out. So we will help any patient in our office that has, asthma or whatever. Whatever your ailment is, we can fix you.
Yeah.
But yeah, so I remember you. Hi everybody. Hi Nicole. And if you guys have any questions, we are here to answer them for the next few minutes, maybe 5 minutes. Any Precision Sculpt questions? If we don't see them coming in, Renata was very sneaky trying to figure out what we were filming in the office the other day. Ooh. Do you want to tell or should we be?
No, we're supposed to be, quiet.
Kind of quiet?
But it's going to be great. I mean, when it comes out, we're all going to have a party. And,
somebody kind of revealed
whatever, right? We don't want to, we'll keep it on the down low right now. But everybody will know.
Hi, Renata.
And it should be great. I can't wait.
Yeah.
All right, well, let's, thanks for being here.
She wants us to tell.
No.
So I think
summertime is what they said.
So I think whatever we were filming should be coming out in the summer. I'll just give a few little hints. Not as well. I mean, people are watching. It's like no one's going to be watching. Why not? No, just teeny tiny. Nothing that's going to reveal. It's on a major network. It's going to be a reality show. We are guest appearances on it. We're not the main people on it, but we are the guest appearances on it. And somebody came in and got some procedures for the show.
Yeah.
I can say
Sure.
that. So check. So it should be exciting. We're super excited to be part of it. And we hope we'll definitely do a big reveal and do a big watch for that particular episode when it comes out.
Yeah, can't wait.
But it'll be on one of those networks that you can watch at any time. Once it airs.
You can binge it.
You can binge it all the time. So, well, thank you guys for watching. Save your questions, DM us, or just come on next time that we're live in one of our question and answer sessions, or any of our sessions.
Yeah, sure. So, thanks for all the patients that are participating today. It's great. We love it. And
thank you guys for all of our questions, and hopefully we'll see you in our office soon.
See you next week.
Bye.